This is Jim Ball reporting at NorthCrest Medical Center. I'm here with Dr. Matt Browning. The 3 recent cases of hepatitis A reported at Greenbrier High School have caused concern throughout the county, and Dr. Matt Browning is going to set the record straight of the true facts of the virus, how it moves, and how to protect yourself from it.
Hepatitis A is a virus that you pick up from other people or by handling food that has been contaminated by someone with a hepatitis infection. Hepatitis A does differ from hepatitis B and C as far as how you can contract the virus from other people. You mostly get hepatitis A from either handling contaminated food that was prepared by somebody with an active hepatitis A infection. You can also get it through the other traditional ways of hepatitis, through exposure to blood products and sexual relations. We've been receiving a lot of calls here about the potential outbreak in the Greenbrier area, and this is some of the information that we've been sharing with our parents and other concerned citizens that wanted to know about their potential exposure risk. First is that if you've had the hepatitis A vaccine series, then you've done about as much as you can to prepare for an exposure like this. If you haven't had the hepatitis A vaccine series before, then this is a good opportunity for you to see your family physician to talk about the benefits of receiving those vaccines. The hepatitis A vaccine series is a 2-shot series that you receive 6 months apart, but it has been shown that you can provide your body with antibodies and coverage within the first 4 weeks after receiving the vaccine. So even now, if somebody were concerned about being exposed to this current outbreak, by receiving the first shot of the vaccine series, they can be building up immunity to it now. People have been asking, well, what does hepatitis A infection feel like? And you can feel fatigued and tired. You can have a loss of appetite. You can also start to see change in your stool color, run some low-grade fever. And if you see your physician and he runs some blood work, he'll be able to identify having some abnormal liver markers in your blood work. Hepatitis A kind of runs its course in the body and then it leaves. It can typically run up to 6 weeks, maybe out to 3 months. And after the infection is over, the hepatitis A virus does leave the body, unlike the other types of hepatitis that we mentioned, hepatitis B and C. Usually the best way to protect yourself all the time, and especially in case of an exposure like this, is to make sure you wash your hands before you touch prepared food, before you prepare food for somebody else, and throughout the day, because most people pick it up from contact with something that has been contaminated by an infected person.
So it sounds like it's a little like the flu on steroids.
Well, I guess that's one way to look at it. That's definitely how it is spread, from human-to-human contact and through generally easy ways that you wouldn't think of, versus things that people, when we say hepatitis, they tend to think of IV needle use or high-risk sexual behavior, even tattoos. But this one is a little bit more commonplace. But the good thing about it is that it doesn't have some of the long-term effects that you hear about with hepatitis B and C, such as chronic liver failure and things like that. This is more of a short course acute infection that will make you feel ill, but will go away with time, and that you can just be very smart about how you handle yourself and how you recover during the acute infection phase. There are lab tests that we can perform as providers to tell you if you actually have been infected with the hepatitis A virus. It's a simple blood test. It can screen for just the hepatitis A the virus, or we could test for all the different subgroups of hepatitis. And if you're going to seek your doctor to have the blood test drawn, then I would also recommend you have your liver enzymes examined to make sure they're normal as well. Sometimes the blood work can show an infection before the symptoms show up, as the body is mounting its initial response. So even if you are asymptomatic, you can still have the blood test done and then know if you currently are building an immune response to an active infection.
You haven't said airborne.
No, most of the time it's usually contact between blood products or fecal products. And the reason we say the fecal, it's kind of an oral fecal route where somebody has an active infection, doesn't necessarily clean very well after going to the restroom, and then touches food that they prepare for other people, touches items in the house that you pick up later. That's generally how things like this are.
What if they coughed right in my face?
Well, that's not very polite, obviously. And you do have some potential salivation that may land on your face, but that risk is extremely minimal. I think if you are in that close enough proximity for them to cough in your face, then you've been exposed in other areas that you're not aware of, such as handling similar things, going back to the food preparation and food items. So if you do know of an active hepatitis A person that has an infection and they're close enough to cough in your face, you probably want to go talk to your doctor about that. So if you're worried that you have come in contact with one of the active infection cases, you can see your doctor and talk about doing the blood test that we mentioned earlier. At this time, if you do become infected with hepatitis A, you're going to feel bad for a little while, but it's not something that's going to be a lifelong problem. You're going to be tired. You may run some fever, and you're going to be a little, nervous about having picked this up when you weren't planning to do that. Just stay in contact with your physician. Monitor your liver enzymes over the course of the infection to make sure that your liver responds well and recovers well at the end of the infection. Like I mentioned, usually it takes about 3 months for the active infection to die off and go away. The virus will clean out of your bloodstream. Your body will have mounted a good response to it, and you'll be fine from then on. The most important population, I guess, is for people that have pre-existing liver conditions. If they are exposed to an active case, they probably should be a little bit more hypersensitive about visiting with their physician to make sure they're monitored. It is scary whenever you hear about an outbreak, and particularly about health. But the reason that you hear about it in schools and preschools is because it's a lot of people in a small area, and that's where it gets easily transmitted from person to person. The best thing about it is making sure that people are aware of it, make sure they have good facts about it, make sure we offer plans for them to be evaluated for it, and to offer the best treatment as possible. Right now, the best treatment is to always wash your hands, know where your food is prepared, and to get the hepatitis A vaccine series to protect yourself.
The Springfield Antique Barn, located at 700 Willow Street in downtown Springfield, has over 30,000 square feet of antiques and collectibles. More than the eye can take in a single day. So set a day aside and come out and consult with one of their many experts to help you find that precious gem you're looking for. Only 20 minutes from Nashville, they're easy to find in downtown Springfield. Come on by. You'll be glad you did.